Have you ever felt your heart suddenly skip a beat? Or maybe it started beating faster than usual for a few seconds, even though you were just sitting quietly. Perhaps you've noticed moments when your heartbeat feels uneven, fluttering, or slightly out of rhythm. Many people over 60 experience this at some point, and when it happens, the first reaction is often worry. Is something wrong with my heart? Sometimes the sensation passes quickly and never returns. Other times it happens again and again, leaving you wondering whether it's something harmless or something that needs medical attention. The truth is that irregular heartbeats become more common as we get older. In many cases, they are harmless and temporary, but in other situations, they can be a signal that the heart's electrical system is changing or that an underlying heart condition is developing. Understanding the difference is important, because while some irregular heartbeats are simply the result of stress, caffeine, or fatigue, others may increase the risk of serious complications if they go untreated. Today, we're going to talk about what an irregular heartbeat really means, why it becomes more common after the age of 60, the most frequent causes doctors see, and the warning signs that should never be ignored. By the end of this discussion, you'll understand when an irregular heartbeat is likely harmless and when it deserves closer attention. And most importantly, you'll know how to listen to your heart in a way that helps protect your long-term health. To understand irregular heartbeats, we first need to talk briefly about how the heart normally works. Your heart does not beat randomly. Every heartbeat is guided by a precise electrical system. Inside the heart is a group of specialized cells called the sinoatrial node, often called the heart's natural pacemaker. This tiny cluster of cells sends electrical signals that tell the heart when to contract. Those signals travel through the heart muscle in a carefully timed pattern. As the signal spreads, the upper chambers of the heart contract first, followed by the lower chambers. This coordinated rhythm allows blood to move smoothly through the heart and out to the rest of the body. In a healthy adult at rest, the heart usually beats between 60 and 100 times per minute. But when the electrical signals change even slightly, the rhythm of the heart can change as well. The heartbeat may become faster, it may become slower, or it may become irregular. When doctors talk about irregular heart rhythms, they use the term arrhythmia. Some arrhythmias are completely harmless and may occur occasionally in healthy individuals. Others can interfere with the heart's ability to pump blood effectively. This is why irregular heartbeats can sometimes feel alarming. Many people describe the sensation in different ways. Some say their heart skips a beat. Others say it feels like a fluttering in the chest. Some notice a sudden racing heartbeat that appears without warning. Others feel a pounding sensation in their chest or throat. These sensations are often called palpitations. Palpitations themselves are not a disease. They are simply the feeling of being aware of your heartbeat, and while palpitations can be frightening, they are not always dangerous. In fact, some of the most common causes of irregular heartbeats after 60 are surprisingly ordinary. One of the most common causes is extra heartbeats, known as premature beats. These are early heartbeats that occur before the next normal beat should happen. When this happens, the heart briefly pauses and then resumes its normal rhythm. That pause is what many people interpret as a skipped beat. In reality, the heart did not skip a beat. It simply had an extra one slightly earlier than expected. Premature beats are extremely common. Many people experience them occasionally, especially during times of stress, fatigue, dehydration, or excessive caffeine intake. In most cases, they are harmless and require no treatment. However, if they occur frequently or cause significant symptoms, a doctor may want to evaluate them further. Another common cause of irregular heartbeat after 60 is atrial fibrillation, often called AFib. Atrial fibrillation is the most common sustained heart rhythm disorder in older adults. In AFib, the electrical signals in the upper chambers of the heart become disorganized. Instead of contracting in a smooth, coordinated way, the upper chambers begin to quiver or fibrillate. This can cause the heart to beat irregularly and sometimes rapidly. People with atrial fibrillation often describe a fluttering sensation in the chest or a feeling that their heart is beating unpredictably. Some people feel strong palpitations. Others feel fatigue, dizziness, or shortness of breath. And some people feel no symptoms at all. AFib becomes more common with age because the structure and electrical pathways of the heart gradually change over time. Conditions such as high blood pressure, coronary artery disease, and heart valve problems can also increase the risk. The reason doctors take atrial fibrillation seriously is because it can increase the risk of stroke. When the heart's upper chambers do not contract normally, blood can pool inside them. In some cases, this pooling can lead to the formation of blood clots. If a clot travels from the heart to the brain, it can cause a stroke. Fortunately, when atrial fibrillation is diagnosed, treatments are available that greatly reduce this risk. These treatments may include medications to control heart rate, medications to prevent blood clots, or procedures that help restore normal rhythm. Another cause of irregular heartbeat after 60 involves the heart beating too slowly. This condition is called bradycardia. While many healthy individuals, especially athletes, can have slow heart rates, an abnormally slow heartbeat in older adults may sometimes indicate that the heart's natural pacemaker is not functioning properly. This condition is sometimes referred to as sick sinus syndrome. When the heart beats too slowly, the brain and body may not receive enough blood flow. This can lead to symptoms such as fatigue, dizziness, or fainting. In some cases, doctors treat this condition with a pacemaker, a small device that helps regulate the heart's rhythm. Heart rhythm disturbances can also be triggered by everyday factors. One of the most common triggers is caffeine. Coffee, tea, energy drinks, and certain medications contain caffeine, which can stimulate the heart and occasionally trigger palpitations. For many people, moderate caffeine intake is perfectly safe. But in some individuals, especially those sensitive to stimulants, large amounts can provoke irregular heartbeats. Stress and anxiety can also affect the heart's rhythm. When the body is under stress, it releases hormones such as adrenaline. These hormones prepare the body for action by increasing heart rate and blood pressure. While this response is useful in emergencies, frequent stress can sometimes lead to episodes of palpitations or irregular heartbeat. Dehydration is another often overlooked trigger. The heart relies on proper electrolyte balance to maintain stable electrical signals. When the body becomes dehydrated, levels of important minerals, such as potassium and magnesium, may shift. These changes can sometimes trigger abnormal heart rhythms. Certain medications can also affect heart rhythm. Some cold medicines, decongestants, asthma medications, and even certain antibiotics may influence the electrical activity of the heart. This is why it is always important to discuss new medications with your doctor, especially if you have experienced irregular heartbeats before. Thyroid disorders can also influence heart rhythm. The thyroid gland regulates many aspects of metabolism, including heart rate. When the thyroid becomes overactive, it can cause the heart to beat faster and sometimes irregularly. For this reason, thyroid testing is often part of the evaluation for unexplained palpitations. Sleep problems can also contribute. Sleep apnea, a condition in which breathing repeatedly stops and starts during sleep, is strongly linked with irregular heart rhythms. Many people with sleep apnea experience daytime fatigue, loud snoring, and pauses in breathing during sleep. Treating sleep apnea can significantly improve heart rhythm stability in some patients. Alcohol can also affect the heart's rhythm. Even moderate alcohol consumption can sometimes trigger palpitations in sensitive individuals. There is even a term doctors use called holiday heart syndrome, referring to irregular heart rhythms that appear after episodes of heavy alcohol consumption. In addition to these triggers, structural heart conditions can also cause irregular heartbeat. Heart valve disease, cardiomyopathy, and previous heart attacks can all alter the electrical pathways within the heart. When these pathways change, arrhythmias may develop. That is why doctors often investigate irregular heartbeats carefully, especially in older adults. Fortunately, modern medicine has many ways to evaluate heart rhythm. Doctors may use a simple electrocardiogram or ECG to record the heart's electrical activity. If irregular rhythms occur only occasionally, a Holter monitor or event monitor may be used to record heart activity over several days. These devices help doctors capture abnormal rhythms that may not appear during a short office visit. In some cases, additional imaging tests, such as echocardiography, are used to evaluate the heart's structure and pumping function. Treatment depends on the underlying cause. Sometimes, no treatment is needed. Lifestyle adjustments, such as reducing caffeine, improving sleep, staying hydrated, and managing stress, may be enough. In other cases, medications may be prescribed to control heart rhythm or heart rate. For certain arrhythmias, procedures such as catheter ablation may be recommended to correct abnormal electrical pathways. And in cases where the heart beats too slowly, a pacemaker may help restore a stable rhythm. The most important thing to remember is that not every irregular heartbeat is dangerous. Many people experience occasional palpitations that are completely harmless, but there are situations where medical evaluation becomes important. If you experience irregular heartbeat together with chest pain, shortness of breath, dizziness, or fainting, you should seek medical attention immediately. These symptoms can indicate a more serious heart problem. Even if symptoms are mild, it is wise to discuss persistent or frequent irregular heartbeats with your doctor. Early evaluation can identify conditions such as atrial fibrillation before complications develop. Protecting your heart rhythm also involves protecting overall heart health. Regular physical activity helps strengthen the heart muscle. Maintaining healthy blood pressure reduces strain on the heart. Balanced nutrition supports healthy circulation and electrolyte balance. Managing stress, sleeping well, and avoiding smoking all contribute to stable heart rhythm. As we age, the heart's electrical system can become more sensitive. Small changes in health, hydration, sleep, or medications can sometimes trigger noticeable changes in rhythm. But with proper awareness and medical guidance, most rhythm disorders can be managed effectively. The key is paying attention to your body. If your heart occasionally flutters for a second and then returns to normal, it may be nothing more than a temporary extra beat. But if irregular rhythms become frequent, persistent, or accompanied by other symptoms, they deserve attention. Your heart has been working for you every minute of your life. Listening to its signals is one of the most important ways to protect your health after 60. Because sometimes the heart speaks quietly at first, and understanding those quiet signals can make all the difference.